season to ensure that we in place a lot of frameworks and protocols and guidelines for protection and development of women and children in Nigeria. On assumption, I realized that we needed to strengthen our protection protocols, for the citizens as the lead protection ministry for the federal government. I visited our only transit shelter, and I knew immediately that it cannot be business as usual. There were survivors there that had no exposure to proper rehabilitation or medical attention. So I began to search for the right solution. And after extensive, consultation and visitations and looking at best practice, I realized that Warif was a formidable partner because they had their systems. Dr. De Silva is somebody who runs Warif as an NGO with no funding from government, and she had A to Z solutions to victim-centered solutions when it comes to addressing issues of SGBV. So today I'm so excited that we have come to this stage in line with global practice where we strengthen the private sector to be able to support protection of our citizens in Nigeria. On this note, may I start by acknowledging the DG NAPTIP, Haji Binta Bello, my mom's very close friend, who was also a former permanent secretary in this ministry. We thank you for your service to humanity. As a former DG NAPTIP, I know what you go through every single day. May I also recognize the permanent secretary of the Ministry of Women Affairs, Dr. Mariam Kashiro, who is ably represented by the Director Child, the Director overseeing the Office of the Permanent Secretary. May I recognize the world founder, the Dr. Kemi Da Silva, Ibru, a woman I have so much respect for, woman with a heart of gold. May I recognize all our directors here present, and the Office of the PHM, the supporting team. I recognize all our partners that are here, members of the press, distinguished guests, ladies and gentlemen. Good morning, once again. It is with great commitment and profound hope I address you all today at this very important moment. A formal signing of the Memorandum of Understanding between the Federal Ministry of Women Affairs and the Women at Risk International Foundation, the WARIF. Today marks more than just the signing of a document, but a significant milestone in our shared journey towards strengthening Nigerians' response to sexual and gender-based violence. It marks our collective commitment to ensuring that survivors of sexual violence are no longer left to suffer in silence, but given access to survivor-centered, high-quality healthcare and support services across our nation. This partnership leverages WARIF's remarkable expertise through its health pillar, particularly the groundbreaking work establishing and operating sexual assault referral centers. Today, we aim to build a future where every survivor has immediate access to professional, compassionate, and comprehensive care. Through this strategic collaboration, we are setting out to achieve four core goals. Number one, capacity building by enhancing the skills and capabilities of healthcare providers, case managers, frontline responders who will ensure that survivors are met with professionalism, sensitivity, and support at every point of service delivery. Secondly, policy reform. Together, we will drive reforms that strengthen national frameworks, align with global best practices, and ensure that law, policies, and protocols genuinely protect and empower survivors. Thirdly, is survivor-centered service delivery. At the heart of this partnership is the survivor and their dignity, their health and their healing. We're committed to services that respect the rights and choices of survivors and ensure that their voices are heard in the healing process. And lastly, but not the least, nationwide awareness. Through coordinated advocacy and public education campaigns, we will raise awareness on the realities of SGBV, dismantle stigma, and encourage more survivors to seek help without fear. Distinguished ladies and gentlemen, SGBV remains a pervasive challenge in Nigeria, cutting across age, gender, and region. The consequences are devastating, not only for survivors themselves, but to our collective humanity, our public health system, and our national development goals. Only through strong partnerships such as the one we formalize today can we create the systematic change that is so urgently needed. WARIF's proven track record gives us confidence that we can scale up and strengthen the network of SACs nationwide, bring critical services closer to those who need them the most. I express my heartfelt gratitude to WARIF under the visionary leadership of Dr. Kemi Da Silva Ibru for their unwavering dedication to this cause. Your passion and persistence inspire us all. I also commend NAPTIP and the ministry and also the WARIF's team who have worked tirelessly to bring this MOU to fruition. And to all our partners and stakeholders, and indeed every Nigerian citizen, I say today is a call to action. It is a call to stand together, to build together, and to ensure that Nigeria becomes a nation where survivors of SGBV are not only heard and healed, but also empowered to thrive. Distinguished ladies and gentlemen, members of the press, I would love to conclude by assuring you that the Federal Ministry of Women Affairs remains steadfast in promoting the rights and welfare and the dignity of every woman, every child, the vulnerable group in the Federal Republic of Nigeria. We look forward to a fruitful partnership with WARIF as we continue our journey towards a safer and a more secured and just society.
Today signifies the start of a wonderful partnership between the NGO WARIF and the Federal Ministry of Women's Affairs. The signing of the MOU today signifies WARIF's commitment towards transforming the lives of women and girls affected by sexual violence, rape, and child abuse in all regions of the country in partnership with the Federal Ministry of Women's Affairs. The women and girls that endure these acts of violence typically do not have essential services adequately provided for them. Neither do they have the judicial system that supports them, nor do they have social welfare to address their needs. Our organization's partnership will ensure the establishment of sexual assault referral centers that provide all of these services. And these services will be provided for free of charge. Thank you very much.
Ma, is this going to be nationwide, or you have specific states where you want to establish?
The rollout...
I ask this question because a lot of the Women Affairs commissioners have said that they don't have the resources for SAC centers. So you find out that in most states, there are no SAC centers at all.
I appreciate the challenge of not having enough sexual assault referral centers across all regions in the country. The rollout will start in established states that already have ongoing facilities in need of refurbishment. And then the intention is to raise the funds, because this is not a problem that affects only one geopolitical zone. This is a problem that affects all six. And in recognizing that, if we are indeed going to impact the problem, I agree with you that sexual assault referral centers must be rolled out in all 6 geopolitical zones.
Can you please highlight more on the specific areas?
Not at this point in time, because we have just recently, as of 5 minutes ago, signed the Memorandum of Understanding. We will now return to the work table. We will now establish the work plan. We will now apply timelines to the work plan, and then we will be able to give you, as well as the public, a definitive agenda, layout, and timelines as to how this partnership is going
Is
to
that when
proceed.
we expect budget proposals?
That is when also, you're absolutely right, budget proposals will be discussed.